with us today. And Brittany, would you like to go ahead and get started?
Sure. Good morning, everybody, and welcome to our webinar. Thanks for attending. I would just like to go through some tips and some approaches I use when I write an abstract for conferences. It's definitely a process, and there are multiple ways to do it, but we'll talk about some ways to approach it. Today's objectives. We are going to discuss why we want to write an abstract. So what's the purpose? What are the abstract guidelines? And we'll use SNRS as an example of some guidelines for an abstract. We'll look at the basic components of a scientific abstract, identify common mistakes that we find in abstract submissions, and discuss tips for successful abstract writing. So the first question is, why do you want to write an abstract? So the obvious answer is dissemination of your work. This gives you a chance to present your work to others in your field. But not only does this share your work, it also gives opportunity for others to give feedback on your work, not only to maybe improve some concepts or some conclusions or add to it to improve a manuscript you're working on, but also to get ideas for what you might do next or how you could use this in different studies. Presenting at a conference is great for exposure. You get your name and face out there, and the more people you know, the more networking and connections you can get. And as a student or even faculty, the networking you can get by conference participation can lead to employment opportunities. And I have found collaborators just by presenting at a conference at different institutions. So it's a great way to get out there, show your face out there, and then just share all the hard work you've been doing. So we're going to start with the first step really in writing an abstract and what you want to do. And so the first thing you want to focus on is reviewing the call for abstracts. So find the specific information that you find when there's a call for abstract for that particular conference. And you want to review the abstract guidelines carefully. You want to consider the purpose of the meeting, and does the purpose of the meeting align with your research study? Who is the audience? So who will be attending this conference? And how would you want to focus your abstract to meet the needs of the audience? What's the required abstract format? That varies widely by conference. And what type of studies are accepted? So do the studies have to be completed at the time of submission? Or can you put work in progress in for your abstract and complete the study by the time of the conference? Does the conference only accept database studies, or are there other types of studies or research that you can submit with your abstract? So these are all important things to consider when you're choosing an abstract topic, and when you're looking at a conference and is it appropriate for your particular area of research. So for example, the SNRS guidelines, so they give you a format, and the instructions limit your text to 2,250 characters, but this includes not just characters, but also punctuation and spaces. So make sure you read carefully to make sure that you're looking at your total character count, if it includes spaces or not. This varies by conference. Sometimes there's word counts, sometimes there's characters, but not spaces. So you need to consider that. The second SNRS instructions is that title case will only be accepted for abstract titles. And so you need to make sure you follow these instructions, or sometimes it can get kicked back and not accepted. So then they offer further guidelines on just the general topics and what kind of research abstracts you can present for podiums and posters. So SNRS specifically accepts completed research as well as theoretical, conceptual, and methodological projects to colleagues. If your research is not complete upon submission, it may be scored lower and could be denied. Sometimes people will still have a work in progress and at least have preliminary analyses. So you could improve this score and still get a abstract accepted if you state this is true and include your preliminary analysis or a proposed plan for analysis and expectations for conclusions. but the study must be complete prior to presentation. And so if you don't submit a completed study, this is often a reason why an abstract is scored lower for SNRS. SNRS does not accept abstracts, which are concept analyses, systematic reviews, critical analyses, literature reviews, or reviews of any kind. And those are all disqualified and not even scored. So just make sure you, first step is carefully read what's accepted before you start putting your abstract together. So we've talked about considering if your research fits the call for abstracts and if it's specific to the conference. And then the second thing you want to do is find the peer review criteria if it's posted and follow it carefully. Because as a reviewer, this is what we use to evaluate your abstract. So we'll go through the SNRS review criteria just as an example when we go through the pieces. But if that is posted and it's available to you in the call for abstracts, that is the best way you can really make sure that what your abstract, all of the data and information on your abstract match the top rated criteria they're looking for. Another good tip is some organizations will publish conference abstracts in a journal. For example, the American Heart Association conference posts all their abstracts in the circulation journal. So that's a good source to go and look at examples of previously accepted abstracts for that conference, so you can really see what the structure and the quality and the content of an abstract that has been presented at that conference in the past would contain. So let's go through some components of a structured abstract. So the components you would need to include would be a title, a background, the objective or the purpose or the aims of the study, your methods, your results, and your conclusions. And this very much looks like when you write a manuscript, and so it follows just the general study design one would have from any research that they've done. But it's important to know that the parts may vary by organization, so always follow their guidelines. So you need to come up with a title for your abstract. And this is not just something that is seen by the reviewer when they read and review your abstract, but it's also what's listed in the program. And so it's what draws people to even see your talk or your poster during the conference. So you want to have a title that seems important to people. You want it to be descriptive of the study that the abstract is presenting. And you want it to be compelling so that people are drawn to it and want to get engaged with your work. It should also be short, specific to the study, and describe the nature of the study. An abbreviation should not be used in the title. So let's look at 3 different titles that could be used for the same study and see how you can have a more descriptive or less descriptive type of title for it. So the first title we could consider is, what heart failure factors affect exercise treadmill test performance? So that might be interesting, especially if you're interested in heart failure. But let's see what else we could do. So the second one is more descriptive. Female gender and history of depression are associated with less maximal effort on an exercise treadmill test in persons with heart failure. Well, that's much more descriptive and very specific, but I also think it's a bit long. If it's a mouthful to say out loud, you probably need to find a more efficient way to say that. So the third one is actually the one I went with in my abstract, was factors affecting performance on a symptom-limited exercise treadmill test in persons with heart failure. So it might not be perfect. I think it's better than just asking a question about factors because it gives you a little bit more information that it's a symptom-limited exercise treadmill test, but it's not quite as long as the second one that's very descriptive and tells you the conclusions, but then it's really kind of a mouthful. So a lot of this is just what sounds good to you and what your collaborators think is a good descriptive title that's not too long but still informative. Some other title examples. be something like factors affecting heart failure knowledge and retention after an integrated self-care intervention in persons with heart failure and diabetes. I think that was a little long, but that's what I went with at the time. So when you look back, you might think, oh, I could have probably written a better title. And then a third example here would be something like patterns of ASC methylation are associated with ejection fraction, quality of life, and depression in persons with heart failure. So I like something like that because it tells you exactly what you're going to see in the abstract, but it wasn't too long while still being descriptive. So you want to consider a title that gets people interested in your study and lets them know what to expect in the abstract and in your presentation. So for SNRS, when we review the abstracts, we have a scale from 0 to 4. And when we look at a title, what we're looking for to really rate it in the excellent category is abstract title that includes keywords from the study purpose and keywords from the abstract text. And then something that lets you know how this is relevant to nursing research. If that's, if you could show why this might impact human health or have another impact on clinical outcomes or whatever your research study is. An unacceptable abstract title would be unrelated to the abstract content. And so you just want to make sure that whatever your title is, that's not just compelling, but aligns closely with your study purpose. So the next section is the background sentence. It's generally about 2 to 3 sentences, depending on the overall abstract length that you're allowed to submit. You need to use a problem statement approach to really give it a punch. So despite the fact that this occurs, we don't know this or we need to know this. So an example would be, studies show that 30 to 47% of persons with heart failure have concomitant diabetes mellitus. Self-care for persons with these chronic conditions is conflicting, complex, and often inadequate. So this background says that a significant number of people with heart failure also have diabetes, and trying to have adequate self-care for persons with both conditions can be difficult because it's conflicting and complex. And so because it's inadequate, that should lead you to think, well, we need to do something and study more about this. So you want to try to say a lot in as few words as possible, but really make it sound like it's important. Another piece is to state what the objective or the purpose or the aims of the study are. This is generally 1 sentence or 2 at most, and it should directly stem from the problem statement in the background section. So it should tell the reader exactly what to expect in the rest of the abstract, because this is where the reader, the reviewer, will make the judgment really as to how important this topic is. Now, often guidelines do not call for a separate section for objectives, and so if that's the case, this should be the last sentence of your background section. So let's look at some examples. The purpose of this study is to describe the trajectory and concentration of pro-inflammatory factors in pericardial fluid after cardiac surgery over time and compare levels of inflammatory molecules in post-surgical pericardial fluid to those in blood. That's kind of long, but that's what the study will describe. And so when I read this purpose, I would expect the methods to address how this information was collected and analyzed, and my results to answer the questions that you would get from the purpose of the study. Another example, the purpose of this study is to examine factors that affect performance on an exercise treadmill test in persons with heart failure. So that purpose should then be reflected in the rest of the abstract. Now, sometimes you want to draw straight from the background and put your purpose in. So here's an example where you start with heart failure is the primary cause for over 1 million hospitalizations each year. Of those hospitalized with heart failure, approximately 40% also have diabetes mellitus. Heart failure self-care management is complex, requiring heart failure knowledge to assess and manage symptoms. Symptomatic comorbidities such as diabetes add to the complexity of self-care, leading to worse clinical outcomes. So the purpose of this study is to examine the clinical and demographic factors related to heart failure knowledge, knowledge change, and knowledge retention after an integrated heart failure diabetes self-care intervention in persons with both heart failure and diabetes. So that's a lot for one background, but what you should pull from this is in the method, you're gonna look for information about an intervention. You're gonna look for information about how knowledge will be measured, and then how you're gonna analyze this sort of information. So when we review abstracts, we really look at the study purpose and problem statement, and then the overall congruency with the background, the problem statement, to show how significant the study is. So what we want to find is a problem statement that is clear, that strongly connects to previous research or evidence-based practice that's been established. And then the aims, the research question, the purpose should be clear, concise, and consistent with the overall study purpose. But then the study also needs to be significant to nursing research and the mission at SNRS. And so it should really, your problem statement and your background should really draw you into what are the consequences of not having this information, or how will this help overall human health. And so you want to give a rationale to support that the study addresses an important problem. So this is where we really look to see, is this something significant and important that we need to find out? And I'm sure it is. It's just making sure that you can express that to the reviewer in your abstract. The next section is our methods, and those can often be hard to write because you have such a short limit in many conference abstracts, and you have so much information that you need to get across. But the methods section should include the design of the study, any procedures that you did in the study, the sample of the study, measurement, any operational definitions if you're using an instrument to operationalize a concept or idea, grouping if relevant if you're comparing two groups, and then statistical analysis if you don't have that in the results. So your method section really needs to tell the reader what to expect in the results. Everything that you put in the method section should directly draw to the results section. Your method section lets me know how strong your study is and what the quality of the overall study design is. And after you read the method section, you should make sure that what the reader would draw from that is what the study design is, what your measures are, and what the sample was you used in the study. And if that's not clear, the reviewer is not going to know what you did to collect this data. So you really need to try to fit in all the reader needs to know about how the study was conducted in as few as words as possible. And sometimes you need to put more methods information in if there's a lot of data that were gathered, and sometimes it can be succinct. So here's an example where there was a lot of information because there were a lot of questionnaires. So this study here, it shows who the sample is, hospitalized participants who had heart failure and diabetes. The group was mean age of 60, mostly men, mostly minority. This can sometimes be in the results. It just really depends on how many characters you have and where it fits with a better flow. So these participants were randomized to either a usual care or an intervention. They were allocated in a 1-to-2 ratio, and they were followed for 30 and 90 days. The intervention, you have to describe what that was now. So it was an integrated education and counseling program focused on self-care that integrates heart failure and diabetes management. The variables and measures were demographic and clinical data. heart failure and diabetes quality of life, and then you have to explain how you operationalize those. So the Minnesota Living with Heart Failure questionnaire, and then this diabetes AdQual, heart care, health, self-care behaviors, and then again, explain your measures, and then diabetes self-care behaviors, and again, you have to identify what you use there. And then you want to show how you analyze this. So for this study, descriptive statistics and mixed models with post hoc testing and effect size calculations were used. So that particular study had a lot of variables that were collected, which really expands your method section, and you have to be even more succinct as much as possible in all of your sections. Here's one that was a little bit shorter. So pericardial fluid was collected immediately after the pericardial sac was incised with the heart beating at time 0, and then from the mediastinal drains at 4, 12, 24, and 48 hours after surgery. So that's how it was collected. In adults, here's the sample size, 18, undergoing cardiac surgery for ischemic or valvular heart disease. So that tells you what was collected, when it was collected, and who the sample was. And then blood samples were collected in parallel. And then how did we analyze the data? Paired t-tests were used to determine differences in measurement between pericardial fluid and blood values at each time point. And so to get something succinct like that, it takes a lot of writing and rewriting, and really trying to find the way is how can I get my message across in as few, not just words as possible, but often as few characters as possible. So what do we look for when we review methods? So an excellent method section will include sufficient detail to provide evidence of a logical consistency between the study's purpose and methods. So you want to, your method section should say, this is how we did the study, and that study design should really fit with the purpose of the study. If you don't include enough detail to let us know what the study did, if it's not clear how the methods aligned with the purpose of the study, you won't get a good score. And so in a quantitative study, you should really make sure that the study design, sample, all the procedures, all your instruments, any data analysis you can put in there should be evident, and that it's all appropriate for your purpose. If you're doing a qualitative approach, it's the same thing. You will need to make sure that the qualitative analysis that were collected meet the purpose of the study. And so here you might want to explain how you recruited the patients. If you interviewed people until there was saturation of data, make sure you're very clear about how complete that data is. So your results section. The results section, this is your data, and data are essential here. Your data should be presented so they specifically address the study purpose. Don't just put in everything that you analyzed if it doesn't fit back with your study purpose. So you need to be succinct, and don't add data that don't address your study purpose. Sometimes your data need to be put into context. So if a number is small or large, if that's a good, bad result. So if somebody scores a 73 on an instrument, that needs to be put into context. If this is on the high end at risk for something, or on the low end protective for something, for example. So not everyone will know what the range is for your instrumentation. You don't have room to write all that as you would in a manuscript. So you just need to briefly make sure that those results are put into some sort of context. So we don't just say, well, I don't know what that means. Do they have more or less depressive symptoms? So here's an example. So I've put the purpose of the study. So let's see how it can track with your results track with your purpose. So the purpose of this study is to examine relationships between ASC methylation and heart failure outcomes. So in the results, we started with the mean ASC methylation. I did not say if that was high or low, so that didn't really put it into context. So that's one thing that could have been done better. Total methylation had a positive linear relationship with BNP, controlling for age and ejection fraction. So that shows a relationship between ASC methylation and BNP is definitely a heart failure outcome. Increased methylation of sites 1, 3, and 9 had a positive relationship with improved Kansas City cardiomyopathy questionnaire score. So here I showed that higher methylation was related to higher, which is better score. So sometimes you can slip in a descriptive word to show that your results, instead of a number of what the level of scores were, just a better or worse kind of context can be helpful. And then a negative relationship with PHQ-9 scores. So here I left that out, and it would have been better if I would have been descriptive about my scores for my PHQ-9, my depressive symptoms. Increased methylation of CPG sites 1, 5, and 7 were linearly related to increased LVEF. So again, I showed that higher methylation was related to higher ejection fraction, and that's really a better way to do things. And no differences in age or gender were found. So that's one example. There's always some good and bad. You always look back at your old abstracts and see ways you could have done it better. But that's why we keep working. So here's another example. So the aim of this study was to test an integrated heart failure and diabetes self-care education and counseling program intervention for its effects on the self-care behaviors and quality of life, and then look at relationships between change in self-care and quality of life. So here we wanted to look at, we did group analysis. So we have at 30 days, the intervention group had improved self-care behaviors and improved exercise over baseline. So here we're addressing the effects of intervention on some healthcare behaviors. At 90 days, the intervention group had improved physical quality of life as measured by a heart failure physical score, improved foot care, so a diabetic outcome, and exercise, which is a self-care behavior for both, over baseline. Effect sizes were small to moderate, so we addressed kind of what the impact of these changes were. In addition, change in the maintenance score, the heart failure self-care maintenance score, in the intervention group at 90 days was associated with total heart failure quality of life. So that addressed the second part of the aim, relationships between the change in self-care and quality of life. No significant or time effect was noticed for the diabetes quality of life instrument. So here you need to make sure in your results that you answer all of the pieces in your purpose. And so when we review, again, we want to make sure your results are clearly presented in relationship to stated research questions or your hypothesis, and then that there's a logical progression or order to your results. You're not just kind of throwing them in willy-nilly. If you don't have a real description of the study results, if you were like, things were good, that's not really going to get you scored well. And then sometimes you might have some good data that you've put in there, but they don't necessarily follow from your hypothesis or purpose, or they just seem incomplete, where you might have left out some important pieces. And even if there were no relationships, that should be stated if that was one of the pieces of your purpose. And then the last part is your conclusion or your discussion. And this is where you want to repeat, you want to interpret your results. You don't want to just repeat what was in the results. And you may need to summarize several results into one sentence to put it into better context. And I can show you an example. And then you should end your conclusion or discussion with the implications of your study for future research or practice. So here's an example. This is from the results we just looked at. on the self-care. So an integrated heart failure diabetes self-care intervention was effective in improving essential components of self-care, including exercise and foot care behavior and perceived physical aspects of heart failure physical quality of life. So I kind of summarized what those results were in words instead of just looking at numbers. Improving overall self-care behaviors were associated with improved heart failure quality of life, but these relationships were not observed for the diabetes variables. So that kind of summarized what the study found. Now, I don't like this last sentence, and I try not to do this, but I ended it with future studies testing a heart failure diabetes integrated self-care interventions with longer follow-up and a longer sample are warranted. There's always more research that needs to be done. So the next one I want to show you a little bit more of a specific way we can find a better implication for a study. So the conclusion or discussion of this study was from exercise intervention in people with heart failure, looking at methylation of a gene and how that relates to inflammation. And so here we said a 3-month exercise intervention was related to increased mean percent ASC methylation and decreased IL-1 beta and ASC mRNA gene expression in persons with heart failure. So that was one sentence that really summarized the important results from the section. So then this left me 2 sentences where I could really talk about the implications. So epigenetic regulation of ASC can be a biological mechanism by which exercise can promote better outcomes in heart failure. So that's a much bigger impact than the first example, I think. Further research examining mechanisms of change can lead to improved understanding of physiological adaptations and a more precise prediction of adverse outcomes in persons with heart failure. So I like this better, and I would review this higher if I were reviewing my own abstract, just because I think it doesn't just say, sure, we need more studies. It tells us exactly what we could do with more studies. So you really want to try to leave it with a good punch so the reviewer walks away thinking, wow, this is really interesting and it's very important. So when we review it, we look to see if you've really evaluated your outcomes, if there were findings that weren't really what you expected, maybe an explanation of what you think might have happened, and then show that your findings have clear implications for nursing science, for patient outcomes, nursing practice, education, administration, leadership, or policy making, whatever your abstract is for. But if you don't really kind of summarize your conclusions and then draw what the implications of this are in your discussion section, you really won't get a high rating there. And then the final piece that we look at is just overall guidelines, and did you follow the guidelines? And so this is where people can have a really good study and lose some points, mostly for either flow or just significant spelling and grammatical errors. And so what you want to do is make sure that you have no reference to who you are in your abstract. It should be grammatically correct without spelling errors. And you should really be able to state what you're trying to say in a succinct manner without repeating yourself, so that when the reviewer reads it, there's a good flow and they don't have to keep coming back and trying to figure out what part B has to do with part A. And so that's the final piece for SNRS specifically, and for most types of abstracts, is just how well was the overall abstract prepared and did it follow the guidelines. So here's some common mistakes that I see when reviewing abstracts. The first one is not following the submission guidelines. And so sometimes there will be something that is a literature review that they try to disguise as an abstract, and that's very clear when you read it that that's not a research study. Or maybe they don't put a purpose in, or leave a part out, or just don't address the overall general guidelines. A lot of conferences now will, when you submit your abstract, they go ahead and do the character or word count for you before you submit. So that's not as much of a problem anymore because you have to get it down within the total length guidelines before you can submit. So that takes a lot of those errors out. Grammatical errors are something that I see a lot. Typos, things that are misspelled, you know, a method section that's one entire series of run-on sentences. So make sure that you don't make that mistake, because that's an easy thing that could be fixed. Lack of clarity, that's another issue where you can read an abstract and you're not really sure how they measured something or why something was included or what did it all even mean. So make sure that your abstract has a clear flow so that your purpose draws from your background and then everything follows from your purpose. Another common mistake is people will write too much background so that their methods, results, and conclusions are each like one sentence. And so that's not really a presentation of a research study. It's more of a, I think this is important, and then you're not really emphasizing your study. And so you want to make sure that you have a good distribution of each section so that each one is complete and really let somebody know what your study does, what you found, and what this means. And then another common mistake is people will have conclusions or implications that don't align with their data. So it could be that it's just wildly unrelated and you're not really understanding as you read it, what does this implication have to do with any of the data that they found? Or sometimes they make 2 or 3 jumps in their last sentence that doesn't really draw you there from their data. So you want to make sure that your conclusions and implications are directly drawn from your data and that they all relate to the purpose of the overall study. Some tips for success. The first one can be hard for people sometimes, but it's so important, is to start early and plan ahead. You know pretty far in advance when the abstracts will be due. If it's a conference that you go to regularly, they're always about the same time, so you should always have it on your calendar for the next year. But if you throw it together last minute, you're really not going to have time to carefully construct your abstract for a powerful impact. Another tip is to get input from others. So you should work with a mentor or an experienced peer, depending on your level and how comfortable you are with the abstracts, to really put that together in a way that reflects the project that you have done and to make sure that it has good flow. Reviewing examples of previously successful abstracts is always a good idea. So like I said, you could look in the journals from previous meetings if that's available, or ask peers or mentors for examples of abstracts they have submitted successfully to that conference in the past. I can't overemphasize that you should proofread carefully for spelling, grammar, and typos. You should have the other authors on your abstract read not just for content, but also get their input on the copy editing of the overall abstract. You should also have somebody proofread it that has nothing to do with the abstract, because they might notice things that the authors don't read because they're so used to looking at that same information over and over. And because you've planned ahead, you'll have plenty of time to put the final version away for a day or two, and then pull your abstract out and proofread again and make sure you still have clarity, good flow, and that it has no grammatical or spelling or typo errors. My advice, the way I approach it, is to write each section first. So you put everything on the abstract that you want to convey. Then you check your word count. And it's invariably going to be way over what you were hoping for. So then you go through and edit it with laser-like precision so that you can meet your word and character count. Now, an example for SNRS, they include spaces in the character count. So sometimes you have to get a little creative. So you can see here, 54 plus or minus 22, written one way, has more spaces than another way, and sometimes you have to do that just to get it under your character count. Your p-value, putting it all together and leaving out the preceding 0, has fewer spaces than if you put a space before and after the equal sign and add that leading 0. You should always spell out abbreviations the first time they are used, but try to limit them to 3 to 5 at most. Too many abbreviations can be distracting, but abbreviations are also a good way to help with your character or word count. I would say that if you are going to use your abbreviations, try to use the most common ones or something people would recognize as much as you can before going to something obscure, and try not to make up your own abbreviations. And then again, I can't overemphasize to be sure to adhere to the word limit and all the technical formatting guidelines for an abstract. Reviewers are going to look for immediate impact of your abstract. So they want an informative title, a significant problem, something that's clearly written, data that match the purpose and support the conclusions, and then a conclusion that builds on data. And you want to keep their attention. So be interesting, clear, and stay on point. I can't overemphasize staying on point. Also be aware that the reviewer may not be an expert in your area. So don't assume they just understand why your study is important. And don't be overly technical where you use obscure language or jargon that only somebody in your content area would understand. And be sure your abstract has a logical flow. They want to have a background that leads them directly to the purpose statement. They want to have a methods and results section that directly addresses the purpose statement. And the conclusion should be supported by your results and address implications and/or next steps that are stemming from this research. So in sum, abstract presentation and conference participation provide great exposure for you and your research. For those of you that are students or postdoc or early career, SNRS is a really great place to get exposure in a way that's a smaller conference that is not as intimidating as some of the larger national conferences might be. The calls for abstract submission include specific guidelines that should be followed exactly. Plan ahead and get input from collaborators, mentors, and peers. Please watch for typos, misspellings, and grammatical errors. And if at first you don't succeed, try again. Either try to revise your abstract for another conference that would relate to your research, or try again next year. But just don't give up. Keep working on it and get there. So if you have any questions, here's my email. You can contact me. And I've also put a link here to my website with some examples from different conference presentations I have done, and with some abstracts. I've mentioned that not all of them are perfect, so don't think that you'll always have a perfect abstract, but it's a good way just to see a progression in how different types of data are presented in abstract form. So we have some time for questions here. So Jennifer, go ahead if you have any questions.
Thank you, Dr. Butts. Since we have a small group, I didn't get any questions to the chat, but feel free to unmute yourself and directly ask Dr. Butts questions. She has been presenting at SNRS since 2013 and has had an abstract accepted every year at the conference since then. So she's a great person to ask those questions to, as the call for abstracts for students and late breakers does open up here shortly in August. So if you have questions right now, feel free to unmute yourself and direct them towards Dr. Butts. It was an excellent presentation. Thank you so much. And maybe you covered so much. Are there specific questions regarding SNRS guidelines that we can answer for you for the upcoming call? Well, it sounds like we don't have any questions right now, but you do have Dr. Butts' contact information, and if something comes it comes up during your submission to SNRS, the 2020 conference, please feel free to reach out to her or directly to SNRS if you have questions about the guidelines. I thank you so much today for your time, and thank you, Dr. Butts. We really appreciate your presentation. It was an excellent presentation. Hold 1 minute. We do seem to have one. We have one comment that it was a fabulous presentation, Brittany. Thanks so much for sharing. It was an excellent presentation. Are there any other questions before we sign off?
I will say, I'll go ahead. If you write down this website here, I can post these slides to my website if you want to find them and look at them later. It may or may not be helpful as you go to write your next abstract.
And we are recording this session, so we will be putting it up on the SNRS website. So it would be a great review for people that weren't able to attend, that are wanting to know exactly what the guidelines are and how to write a great abstract. But I will be sharing the recording on the website and with everyone who is registered. So thank you all so much for attending. We hope you have a lovely day. We do have another webinar coming up on August 28th. It is on our website under events, so please do look at that, and I hope to see you on the next webinar. Thank you so much, Dr. Butts, for your time.
You're welcome. Thanks for coming.
Yeah, thanks all for coming. Yep, have a great day, everyone. Bye-bye.